Afternoon, good evening. I'm David Sunderland. I'm the chair of Plenna and delighted that you could join for this launch webinar. Plenna has been in existence for 2 years, but we launched the new website. It came online 3 weeks ago, and this is the opportunity to have an official launch, if you like, and a discussion. As it's being recorded, it will be great to share afterwards. The subject is Die Well, Live Fully, a global conversation. And it's about death and dying, how we value it as part of life, how we navigate differences across languages, cultures, and borders, and how we make it accessible using digital tools. Let me welcome our panelists. We are still waiting for Richard Smith to join. Hopefully he will arrive in the next few minutes. We've got Natacha Madaule, Michael Hebb, Mia Urad, who I think will be joined by Nozomi Ishikawa, and Ayman Abdelmohsen. And I'll introduce each of them in turn, and they will speak for up to 10 minutes each. I should say, in terms of logistics, we have a simultaneous Japanese translation, interpretation. And so I encourage people to speak slowly and clearly, so to help the interpreters. We will have time at the end for questions and answers. In terms of the run of show, I thought it would be interesting for the speakers to make their presentations. I will then invite them to comment on what they've heard from the previous presentations and then open up using you can make questions either in the chat or you can put your hand up virtually, and I'll bring you in. Maybe before I introduce the speakers, just a few words on Plenna. So Plenna, it exists because the taboo around death and dying creates unnecessary suffering, and it aims to help individuals accept, consider, and potentially plan for death and dying. And it principally does this through the new site, which provides a short questionnaire which allows people to assess the extent to which they are prepared. And then that also points people to other information. At the moment, it's just in English. The plan is to have 9 other languages. And I'd like to say a quick word of thanks to our donor so far, the main donor, which is Swiss Yearly Meeting, or Quakers, which has helped us to develop the website and the database. Also, enormous thanks to multiple volunteers, particularly the board. And I won't list them, but on the site, it does list in the About section all of the people who have helped in different ways. And thanks today to Rory as well. We welcome any encouragement, support in kind, and donations. Without further ado, I think we'll make a start. I don't see Richard Smith, so we'll turn to Natacha, who is coming to us from Geneva. I am delighted she could join because Plenna is a Genevan-based association, even though its outreach is global. And she and I have had numerous conversations, normally in the same coffee shop in Geneva. And I'm really very appreciative of her guidance and her thoughts. And it's very appropriate that she kicks us off today. So Natacha, over to you. And I would encourage you perhaps you might wish to obviously mute and close your cameras. And Natacha, after 6 or 7 or 8 minutes, I'll put my camera on and help you to round off around 10 minutes if necessary. But over to you, Natacha.
Thank you, David. So I'll just find my presentation and I'll start. Sorry, I have some issues sometimes with my eyesight. I'll get there. Voilà. Good, all good. So I'm Natacha Madaule. I'm the director of Palliative Genève. So probably wondering what is Palliative Genève? So it's the Geneva section of Palliative CH. It's the Swiss Society of Medicine and Palliative Care in each canton. Canton is a state in Switzerland. We have a section, and our role mainly is to inform and raise awareness on palliative care, both for the professionals and the general audience. That's why I'm going to talk both of the value of death in life and the culture aspect, because Switzerland is really interesting on that point. So just a quick word about palliative care to be sure we're all on the same page. Oh, sorry, I realize I'm talking a bit too fast. So I'm going to slow down for the interpreter. Just have to be careful about that. So I'm taking the definition of the World Health Organization. So the palliative care is an approach that improves the quality of life, which is important, of both patients and of families who are facing problems associated with life-threatening illnesses. So it is important it prevents and relieves suffering through the early identification and correct assessment and treatment of pain and other problems, whether physical, psychosocial, or spiritual. So I would say in a nutshell, palliative care improves the quality of life, it reduces suffering, it intervenes at an early stage, and I really insist on that because it's not just the end and end of life, but it can start at the diagnostic, so it can take years. And it supports the family. So that's another important point. That's why you'll see, well, the impact of palliative care on the value of death as a part of life. What is interesting is that it changes the perspective of the end of life. So the end of life is seen now as a state that should be accompanied, sorry, with my French accent, with dignity. So it helps to integrate the end of life into a more holistic view of the person beyond the illness, which will help bring a vision of death that is less threatening. Palliative care brings as well an interesting emphasis on dignity and autonomy, and it changes the approach of death. Indeed, the patients in palliative care are encouraged to express their wishes, where they want to die, the intensity of the treatment, the spiritual aspect as well. And in Switzerland, maybe it's probably the case in many other countries, we have what we call advanced directives. It's a document in which the individuals write down, their choices for the end of life, which is really important. And this as well is another step to bring a life that seems a death that seems less threatening. Another point as well is that the holistic support of palliative care opens up the space to talk about death, which is really, really important. Indeed, because palliative care is not only the relief of physical pain, but of the psychological one, which is anxiety or fear of death. The social one, because sometimes loneliness can appear, what is the role of the family, and the spiritual one. So really it opens up the space to talk about death, which can be quite taboo in the Western culture. We can talk about that a bit more as well. And it changes the place of death. So with palliative care, we emphasize it well to die at home or in specialist care facility to allow a more peaceful death and be surrounded by the loved ones. So I would say the impact on society is really interesting because it promotes the solidarity and the role of family in the end of life. And it helps to bring it something less taboo because we can talk about it in schools, in institutions, in the media. That's one of our role actually as a section. Palliative Genève and all the others palliative section, we raise awareness on that. We do campaigns to talk about palliative care and death and kind of, break the taboo of it. And we work as well on this development of a culture of dying well, if you can say so, which means dying without suffering or less suffering, surrounded by loved ones and being respected. So it's really interesting to see how palliative care can have an impact on this value of death as part of life. So if I can say so, palliative care shifts the approach to death from fear and medicalization to a more humanized, dignified, and supported acceptance. So it restores really death into its rightful place in society, in the cultural life. So if we go in Switzerland, what is interesting is that you'll see different changes in the aspect on death and the approaches to it, because Switzerland is a confederation. It's a bit like the United States. We have 50 states. In Switzerland, you have 26 cantons, and each canton has, well, there are the federal laws, but then you have the cantonal laws as well. And we have 4 different official languages. So you'll see in red all the German-speaking part, which is the majority. Then in blue is the French-speaking part. Green one is the Italian-speaking part, and the yellow is the Romanche. I would say like the Swiss language. It's a Roman language, which is talked by 0.8% of the population. But it will bring, it's a little bit like each canton is a little country in itself, and you'll see differences in the approaches. We have, for instance, the German part is mostly Protestant, so we'll have a more sober approach on regarding death, and as well they will be more open to discuss about the assisted suicide, because if you don't know, in Switzerland you have the option of assisted suicide if you want to, but it's with a dignitas or exit, but it's well how would I say, structured. Then we have the French part, which is mostly Catholic. So well, it's a question of religion as well, but there's a growing acceptance nowadays, but it won't be maybe as often applied, let's say, the approach to assisted suicide, maybe than in the German-speaking part. The Italian-speaking part, we have a really strong Catholic influence, which will be a bit more family-centered as well. We have like processions, remembrance of ancestors. For instance, I'm here in Geneva, it's a Protestant canton. So we don't celebrate the All Saints' Day. Well, we don't have an official day for that. But if I cross and go to Canton de Fribourg, there you have the day off. There'll be more processions. So there are all like different little countries. Then the Romanche part is really interesting. They have much more community-based, let's say, rituals. If I go to this one, for instance, you have like bells with different codes announcing if it's a girl who died, an elderly. Usually you'll have, in the mountain, in the villages, some special processions. You'll have the mourning of the deceased one at home, which you won't necessarily, which will be less often maybe in France or in the French-speaking part or the German-speaking part. So you'll see the rituals will be really different. Another instance as well is that you'll have, for instance, the Italian part, which is a bit more Mediterranean, if we can say so. We'll have like the funeral processions. The mass will be Catholic mass will be more grandiose, which won't be the case in the German part. So those are all just little instances to show, like Switzerland is a little bit a summary of different culture, and you have the influence. The French-speaking part can be a bit more influenced by the French culture as well, where we'll have a more formal way of announcing the death of the loved ones and the way we ritualized, let's say, the mourning at home or other things. And then in German-speaking part, well, we have the German influence and etc. So it's really interesting to see just in one country where we can see so many differences in the approach of death and those visions as well. And I think just all I wanted to say is that which is interesting too in Switzerland, is that you have the secularization of society is growing as well. So it will have an impact on the way we see death or other thing on this case as well. And And we have, there was one instance, I have to find it, which was really interesting. We have more and more, let's say, ecological burial processes as well, which are maybe more not common, but they apply it more in the German-speaking part as well. So let's say that things are evolving in an interesting way with all those different cultures too. So that's it for me. And if you'll have questions, I'll be happy to answer to them.
Fantastic, Natasha. Thanks. That's really interesting in terms of giving the different cultural perspectives in a single country. So really grateful. We will have a chance for questions at the end after the panelists have had a chance to react to each other. But let me pass over to Michael straight away for his presentation.
Right. Well, thank you, David. Honored to be here. My name is Michael Hebb, and I'm the founder of an initiative called Death Over Dinner that started in 2013, and also the author of a book that has been published around the world called Let's Talk About Death Over Dinner. And I continue to teach death awareness workshops and be very much involved in this work. The project Death Over Dinner that some of you may be aware of started 13 years ago. And the goal was really to create a ritual so that people could have a conversation about end of life, grief, and terminal diagnosis when they weren't, when they're not, and when they in the middle of a crisis, so that a family and friends, coworkers, et cetera, can have a less pressured environment to talk about, their kind of open-ended relationship or a very specific relationship to end of life, terminal diagnosis, and grief. And since we launched in 2013, there have been well over 2 million people who have participated in the ritual, and on every continent and all over the world, and has been translated into many languages. And before I talk a little bit more about the project, I want to introduce the idea of metaphor and story, because I think it's very important as we work with end of life and as we think about it. Sometimes we get very clinical. And for me, when I begin a workshop about end of life and death, and I teach these workshops all over the world, I ask the people that have gathered to consider death a little bit more like a forest. So, and specifically a forest as it's starting to get dark. It's dusk, and now it's dark, and you're in the forest, and you're alone. And if you don't know the forest well, if you don't know a forest well, in general, every sound that you hear at night in a forest, a twig breaking, a strange call from an animal, can send you into terror, into fear, into fight or flight. Now, if you know a forest and you know it well, and you've spent time there and you understand its inhabitants and how its systems work, and who might be lurking around and who might be beneficial and who might be a threat, a forest can become a place of awe, of wonder, of nourishment. And the same is true about conversations about death. When you don't have them, when you are not literate in these conversations or experienced in these conversations, they can be very threatening. The smallest thing can trigger a past trauma, can trigger any number of things. And so what we do with Death Over Dinner and with the other work that I'm involved in is work to create literacy, to create that kind of understanding so people can, still be prepared. Even the most knowledgeable forest adventurer knows that there are threats, knows that they have to be prepared, has respect, understands that there are many unknowns. But without literacy, you can have no agency. And so our project is meant to be an intervention, a cultural intervention that comes before the clinical, or perhaps after the clinical, or even after the death, so we can talk about grief. And briefly, the way that I think about death, end of life, grief, the last chapter, this whole area that we're discussing, is I think about it as one of the greatest spaces, opportunities, invitations for humans to connect, to find meaning, to find each other, to create self-knowledge and awareness. And it also, so it's this thing that draws us in. We see this with funerals and mourning, not as much as we'd like to see with grief in general, but it invites us in when there is a terminal diagnosis, when there's an ICU experience, when there's a death, when there's when you're gathering in Shiva. This is an invitation in. And then the question is, are we ready for that kind of intimacy, right? What is the work that we can do in preparation so we can take advantage of the time when death and end of life calls us together? Because many of us who work in this space know and see the type of incredible healing that happens, transformational, the type of incredible connection and reconnection that happens between family members. And also, on the flip side, the type of isolation, the type of moral hurt, the type of, the triggering, the traumas that come up, the family dramas. So it's really a question about, are we prepared for the type of intimacy that death calls us, to be present to? So a little bit about how we created Death Over Dinner. We thought about a lot of different topics that we could ask people to talk about at the dinner table, and decided that death in many ways was going to be one of the most provocative, but also beneficial conversations we could ask people to have at dinner tables around the world. And so we created a simple model, and it's always been free. The whole organization is not even a nonprofit. People are like, how do we support you? It's like, it was a gift. We created it as a gift to the world. And on the website, deathoverdinner.org, people will be asked a couple questions. Are you grieving? Do you have a loved one in the ICU? Do you yourself, are you yourself struggling with a terminal diagnosis or have been confronted with a terminal diagnosis? And a variety of different questions that allow people to identify why they want to have their intention for having a dinner. And then there's a specific script and guides for how to have that experience. So people can sit down and they don't have to think, like, what are the questions that we're going to ask? It starts with a ritual, all of the dinners, where people light a candle and honor their ancestors, somebody that they have lost. And then depending upon which script you get, there's about 4 or 5 questions that get deeper and deeper and a little bit more vulnerable. And the impact has been pretty extraordinary. And when we launched it, like, can we make a set of dinners happen around the world? And there were around 500 dinners the first night in 2013 in about 20 countries. And we've seen it grown significantly since then. And we've created the Jewish edition of Death Over Dinner. We've created the clinical edition of Death Over Dinner with the Cleveland Clinic. And we've created a Brazilian edition, and many other people have translated it into various languages. And one of the key reasons why Death Over Dinner has worked, I believe, or a couple of them, and then I'll pass it back to David, is that we made the site beautiful. There is not enough beauty in end-of-life interventions. And we made sure that we were speaking to every part of a person. Make beautiful food, but also the website is intentionally very beautiful. We made it free and we put no trademark on it. We want people to own their own death over dinner experience. So there is death over dim sum. There is death over deli. There's death over drafts. I see every kind of variation imaginable. And I just get these incoming messages of it happening in Singapore, in Canada, and Russia, and all over the places, being done in completely different ways. So we gave it as a gift, and we did not trademark the details of it. There's also just no hierarchy in the conversation. So many of the end-of-life interventions are focused on one person having to make decisions, or one person that's, dealing with the diagnosis, or one person who's been most specifically impacted by a loss. Death over dinner creates a space where there is no hierarchy and there is no specific point on a single individual, where people can speak openly and safely about their own relationship to end of life. So I'll pass it back over to David at this point.
Brilliant, Michael, and really inspiring. I've been to two death over dinners and really enjoyed them. It was very moving experiences. And also your book is on the Plenna website. There's a short book review. And you and I had a really interesting chat about a month ago, which I really appreciated. So fantastic that you've been able to join today and share. And I love the forest metaphor. Let me pass over to our Japanese speakers. And just a word there, there is a slight UNFPA connection here. We've got Ayman coming up afterwards. I used to work for UNFPA, and during that time I met a Japanese colleague called Chisato Masuda, and she helped me develop a couple of Japanese country signposts and introduced me to Death Fest when I was in touch with Mio and Nozomi. So I'm really delighted that they've been able to join today and will be giving their perspective from Japan. Let me pass over to them.
Hi. Hello, everyone. I'm Mio Urade. I am a board member of the Death Fest Association in Japan. Death Fest began 3 years ago in Shibuya, Japan's center of culture. It was founded by my colleague Nozomi and Lina. We aim to create a society where both life and death can be embraced with well-being. I'm very happy to be here today, and I look forward to our discussion with all of you. Today, I'd like to share more deeply about Death Fest, our ideas and activities. To do that, I will first speak English in Japanese, and then our interpreter will follow in English. This means we'll take a little extra time, and I'd be very grateful for your patience. Thank you. And from Nozomi Ichikawa, the representative of the General Incorporated Association Death Fest, we have prepared a video introducing our organization. We would now like to play it. Please wait a minute. Okay, let's start.
Hello everyone, and thank you for having me today. I'm Nozomi Ichikawa, co-founder of Death & Co., a Japan-based initiative exploring how death can open up new possibilities for life, well-being, and society. It's a pleasure to be part of this global conversation together with my colleague Mio Urade. Please note, as English is not my first language, I'd like to speak from my heart in Japanese. I've added English on the slides, and I hope that will help. Thank you for kind understanding. ここから日本語で喋ります。私たちのパーパスは死を起点に社会の未来を開くです。主な事業は5つあります。法人向けサービス開発・研修事業、リサーチ・研究事業、競争プラットフォーム事業、 コミュニティ事業、そして年に一度のデスフェスを含む文化競争事業です。デスフェスは死というテーマに出会い直す祭典と位置づけています。デスフェスには3つの柱があります。トークセッション、没入型体験と対話ワークショップ、そして企画展示です。デスフェス2025を数字で紐解いてみると、6日間で68プログラムを実施。延べ来場者数は4200人を超えました。文化の中心地である東京の渋谷、商業施設のオープンな空間を活用しました。協賛、協力、出展事業者数は72社。登壇者は他分野から135名の方にご協力いただきました。一般来場者は10代から90代まで。多世代が参加。国内外のメディアにも多く取材していただきました。参加者の声です。高い評価をつけてくださった方の主な理由としては、新しい視点や学び、発見があった。死を考えるきっかけや語れる場が提供されていた。雰囲気が温かくて居心地が良いなどが挙げられていました。それらから見出された価値としては、死を語る、考える場の希少性、多様な死生観との出会いが挙げられると考えています。では実際にデスフェス2025のハイライトをご覧ください。
笑ってきて笑ってきて。1年が短いのか長いのか、私がどう生きたいかとか、私が何ができるか、概念を変えるためには、例えばさっき白田、青木に入っていて、本当に自分が知ってるイメージをしてみるというか、そういったできたようにしか、なんか死んでいけないんじゃないか。このボイスカード、実際に変えると。
体験談体験を終えて、すごくスッキリした気持ちで、一度死というものを実感して、そこから蘇るという経験を積めさせてもらうのが、本当に人生の節目、考え方にすごくアップしていて。
やっぱりこのメッセージをちょっと読んだら、すごく重いことを書いてる人いて、ここに来て、金銭なんですけど、もう初めてもっと死について考えなきゃいけないんだってすごい思いました。
でしたし、何かこう一緒に深い感覚を味わうことができた。とてもいい体験になりました。
いかがでしたでしょうか。私たちデスフェスはポップさというのをとても大事にしています。死をポップに捉えることです。それはなぜかというと、恐れを和らげたり、誰もが語っていい、そういう空気感や自由さ、何を発言してもいいという自由さや遊び心で死を尊重しながらもタブーを超えて文化を開いていくためです。そのために私たちはポップなしつらいでやっております。私たちは死を終わりではなく始まりと捉えて、個人の内政から社会全体の変容へ、死を起点に生も死もウェルビーイングな未来を共に創造していきます。ご清聴ありがとうございました。Thank you。ここからはみおさんにバトンをタッチします。よろしくお願いします。ありがとうございました。
Thank you for watching our presentation, and my part is finished. デイビッドさんにお返しします。
Over to you, David. Thank you. That will be it from me.
Thank you, Mia and Nozomi, for the beautiful video and presentation. Really fascinating. And interesting to see how, in a Japanese context, you raise the issues. Let me pass then to our final speaker. I'm still holding out hope that Richard Smith might join us, and perhaps he's got the hour mixed up. But Ayman and I also worked in, and here is Richard. Welcome, Richard. But we'll pass over to Ayman, who works for UNFPA. And Ayman, I'll let you introduce yourself, and looking forward to hear from you.
Thank you, David. And good morning, good afternoon, everyone. And my name is Ayman Abdelmohsen. I am the Chief of the Sexual and Reproductive Health and Rights Branch at the Program Division at UNFPA HQ. The whole Program Division has moved and is now based in Nairobi, Kenya. So we are closer to the countries that we serve. So I am a medical doctor. I'm an obstetrician gynecologist by training, and my first part of my career, I spent my first 17 years of my life working as a clinical OBGYN in my home country in Egypt. I'm from Egypt. And I was thinking how best to contribute to this interesting discussion, because honestly, David surprised me with the discussion around death and life, and which is something I did not put enough contemplation on. So I'm happy to speak a little bit about UNFPA, but David and colleagues, if you allow me to share some of my personal reflections on this, I hope that is okay, David. So with regards to death, I would like to speak a little bit about my country and about maternal deaths and about the perception of maternal mortality in a country like mine. Egypt is a very religious country, and whether it's a majority Muslim or a minority Christian, and sometimes we take religious interpretation in the right way, but in many other ways, we sometimes misinterpret them in a way that we consider as religious, but I personally think that it is a misinterpretation. When it comes to death, and when it comes especially to maternal mortality in a country like mine, what happens is that many of the family of the victim, they come and try to convince themselves, okay, it was an act of God. There was something that we could have done about it. The mother has died. This is God's will. Nobody dares to speak about God's will, and nobody dares to argue against that, which has put many families and many cultures into some sort of a complacent methodology, where they never dig for the reasons, and they never look enough into how they can prevent something like this, which I've spent a very long time of my career working in a teaching hospital in Cairo, where the lower social class used to come for delivery with all the complications that you can see. And many of them, I mean, we're having many complications of labor and pregnancy. And of course, some of which, I don't want to say many of which, unfortunately lost their lives. And when you look into the reality of these cases, these are real women like my mother, like my sisters, my wife and daughters, who lose their lives for reasons that are so preventable as early diagnosing that they have anemia, and they can really simply treat their anemia during pregnancy by having iron and folic acid supplementation and having some good quality antenatal care, at least that will identify them as prone to postpartum hemorrhage. Simple reasons that end up to many nice young women losing their lives for preventable reasons. And honestly, that's the very reason why I started working into what I'm working on, because the lack of knowledge and the lack of interventions that are so simple and so impactful that it can save lives to this extent, we don't have them equitably accessible to many of the countries that we serve. Which brings me now to UNFPA, and this is where I think where the crux of the matter is. So UNFPA is the UN leadership agency for sexual and reproductive health and rights. We have a unique mandate that we work to ensure that every pregnancy is wanted, every childbirth is safe, and every young person's potential is fulfilled. And this is where, when we talk about the sexual and reproductive health role, we are basically the lead agency for population and demographic data. And this is also a very important aspect where we have our CRVS work. We support the establishment of country-based censuses. We support countries to collect, analyze, and use high-quality census and population data to inform evidence-based policy and planning. So we just got approved for our upcoming strategic plan, which emphasizes three main outcomes or transformative results: ending unmet need in family planning, ending preventable maternal deaths, and ending all forms of gender-based violence. So when we talk about reducing maternal mortality, we are facing a persistent global challenge. Globally, we have made significant progress. However, maternal mortality remains unacceptably high, particularly in low and middle income countries, for many reasons that are so simple and so preventable that with minor knowledge and minor interventions, you can really shift the needle and reduce maternal mortalities. Experiences from diverse languages, cultures, and borders show that on integrated strategies, especially when it comes, and I'd like to emphasize on this, skilled midwifery care, functioning health systems, and reliable supply chains for life-saving commodities, coupled with strong political commitment, are life-saving interventions. So back to what my colleagues presenters were talking about, the value of life versus the value of death. I think it is very important that while we are mandated and we believe in what we are doing now, in order for us to support a valuable life for all the people that we serve, and in order for us to prevent any preventable death, I think we owe the whole world to make sure that they are well educated about how valuable their life is and how important that they do not interpret or misinterpret religious factors that makes them complacent and underappreciating the value of their lives, so we can work together to improving the livelihood and the well-being of those that we serve. Let me stop here, and I'm happy to respond to questions or remarks. So I'll give the floor back to David and colleagues. Over to you, David.
Ayman, thanks very much. That was really, I think, spot on in terms of giving your personal perspective and the institutional perspective. I think it's interesting when you look at the question of death and life, death as part of life, realizing the parallels and similarities between birth and death, for example, which you touched upon. I might add as well that in my experience with the UN, there's been development a lot on comprehensive sexuality education, but with a wider framework of life skills education, there could be a lot more done on death literacy and death education, which you intimated in your presentation. Richard, it's great that you were able to join. I'm sorry for the confusion with the time. This is the first time that we are seeing each other face to face. Richard and I have corresponded a little in the context of him being the co-chair of the Lancet Commission on the Value of Death. And we're very grateful you can join, Richard. Just to give you a sense of the running order, you've got up to 10 minutes to present. Afterwards, I'm going to ask each of the presenters to react to the others if they wish, and then we'll open up for wider questions and answers. But over to you, Richard.
Well, right. Well, thank you very much, David. And I think I need to start by apologizing for getting confused over time. I ought to, at my age, I ought to be able to sort that out. And I also want to congratulate you, David. I think starting Plenna is an important step forward in encouraging people to think about death and dying, because certainly here in the West, I think we live in a world where people don't think about it enough. So as you said, David, I was the co-chair of the Lancet Commission on the Value of Death. We reported a few years ago, but the work continues. The other co-chair was Dr. Libby Salnow, who is a palliative care physician and a professor of palliative care at University College London. And our sort of starting point was that we, and I'm talking predominantly about the West and about high-income countries, although the Western way of death is spreading to low and middle income countries, often with disastrous consequences. Our starting point was that we have an unhealthy relationship with death and dying. You know, death and dying is completely normal, and yet somehow we've pathologized it, we've medicalized it. So you saw this particularly during the pandemic, when people were dying in intensive care units, unable to communicate with their relatives apart from through iPads or phones, surrounded by people in masks. It's a sort of ultimate medicalized death. And we probably, in retrospect, made a mistake asking people to die like that. There is a lot of over-treatment at the end of life. There's a lot of over-treatment during life, but especially at the end of life. There are quite a lot of people who do not even know that they are dying until they are very close to death, and their relatives don't know either. So they are unprepared. The problem is that for an oncologist or a surgeon or people, cardiologists treating people near the end of life, it's a lot easier both for the clinician and for the patient and for the family to live in a world of pretense and go on treating rather than having what's been called the difficult or the essential conversation. It's endlessly put off until it's very late. I think although a lot of doctors would deny it, you know, death in some ways is the number one enemy, and people are out to try and defeat death, which of course is never going to be achieved, although a lot of money is being spent trying to do so. And in medicalizing death, we take it away from families and communities, which is where it really belongs. And there are people out there, you know, pursuing immortality. We've just heard Putin and Xi Jinping have a conversation about they, rich, powerful men, would like to live much, much longer. And there's lots of money being spent pursuing dramatic extension of life, even immortality, particularly in California and Silicon Valley. So death has been medicalized, but also for people in the West, death has tended to become unfamiliar. 100 years ago, death was very familiar. It was much commoner. People died younger. They died more quickly. Now death is hidden away in many communities, hidden away in hospitals. The corpse is whisked off. Coffins are closed. So people have become very unfamiliar with death, unfamiliar with what it means to die, how people die. And consequently, I think it's become much scarier than it is in reality. And people don't know how to respond when a relative or a loved one is dying. And then touching in some ways on what Ayman was saying, globally, we have a paradox insofar in high-income countries, many people are being treated excessively. Life is being, the end of life is becoming very uncomfortable. Suffering is actually increased by this over-treatment. And yet, in many places in the world, people don't even get the most minimal palliative care. People don't have access to morphine at the end of life, which is often a very powerful and effective drug. I have to say as well that there's a lot of evidence that it's over-responding to death and dying is a common cause of bankruptcy in low and middle income countries. People go to excessive lengths to try and keep people alive, bankrupting the family as they do so. And of course, that also happens in countries like the US, where there isn't universal coverage. So, and another problem is that rather than death and dying being, as it clearly is, a family, community, cultural, spiritual phenomenon, it's increasingly become run by doctors and nurses and other health professionals. But what we would like to see is that the community is really in charge. Doctors and nurses and other health professionals, of course, have a role, but that it belongs to the community, and the doctors and the nurses are supporters doing what they can when it's necessary, rather than the people who are running the whole show. And actually, this is something that exists in Kerala, in the south of India. It's an example of how it is possible to change the way that people die and think about death. So with our Lancet Commission, we developed what we called a realistic utopia. This is an idea from the philosopher John Rawls, that it's a utopia, it's something we aim for that is in the end achievable. And I should add that one of the things we realized through the commission is that we're not going to achieve this through, little changes here or there. For example, in Britain, something called the Liverpool Care Pathway was introduced into hospitals, where about 50% of people in Britain die, in an attempt to make it more like hospices. But it was a horrible failure. We have much debate in Britain at the moment about assisted dying, but none of these things will on their own sort out and help us to achieve a healthier relationship with death. We need what is called a systems approach. We need to think about attitudes to death, how much we discuss death. We need to change the whole death system, which has many different components. It's not just a matter of hospitals and doctors and nurses. So our radical utopia has 5 components. The first is that the social determinants of death, dying, and grieving should be recognized. This relates a lot to what Ayman was just saying. Health, we realize, is not a function of health systems. Health systems have a role to play in health, but our environment, our genetics, our lifestyle, the way we think, these are the things that are much more important for health. Income, education, employment, the food we eat, all of these. And these things apply to death and dying as well. So as Ayman said, we should be preventing all the deaths we can prevent, and we should not be over-treating those that where it's become inevitable. The second is that in our realistic utopia, death is understood to be a relational and spiritual rather than a physiological or medical event. And that's at the heart of what we're advocating. Thirdly, there should be networks of care for people at the end of life, people who are grieving, and people are caring for those who are dying. And this, as I said, is what exists in Kerala. And also around the world, there are things called compassionate communities, where neighbors, friends, communities come together to support people and change attitudes to death and dying. The fourth thing we would want to see, and this relates very much to Plenna, is conversations and stories about everyday death, dying, and grieving become common. And, we have death cafes. A lot of these conversations used to take places in churches and religious places, but in a country like Britain that's sort of post-religious, they don't tend to happen there, or they don't reach most people. Death festivals, gathering stories and conversations about death and dying. And we think that by familiarizing people with death and dying, it will take away the fear and give us a much healthier relationship with death. And then finally, we need to recognize that death has value. I mean, the whole of life is built on death. The whole of evolution is built on death. Life and death are opposite sides of the same coin. And without death, every birth would be a tragedy. And unfortunately, in our overpopulated world, we hover on the edge of that. Max Planck, the great German scientist, says that science advances one funeral at a time. We need, to sweep away the old and let the new come through. And certainly for me, and I think many others, death gives a shape, a narrative, even a meaning to life, a time to be born and a time to die, as the Bible says. It reminds us that we are part of nature. We are not above nature. I think it's a major problem for humanity that we've deceived ourselves into thinking that we are masters of nature rather than part of nature. And I think too, death is the great equalizer. I mean, at the moment, Vladimir Putin and Xi Jinping and Trump cannot escape death. Death will come to them as it comes to all of the rest of us. And it reminds us of our fragility, which is central to our understanding of life. And then caring for the dying and relating to the dying, particularly your own parents, your own grandparents, your spouse, is actually often a great privilege, and it teaches you things that are not taught in any other way. Gandhi, in his autobiography, writes that looking after his dying brother-in-law was one of the great events of his life. So I'm coming to my conclusion, David. I see you've switched on. I just want to end by saying that the report, the Lancet Commission on the Value of Death, it's online, it's all for free. I have to say we've made limited progress since we published the report back in 2022, but much more is planned, and we have a website, and I'd invite you to come to the website and join what in some ways is a mission, a social movement. Thank you.
Thank you, Richard. And yeah, I would thoroughly recommend reading the Lancet Commission report, very rich and robust. We've come to the end of 1 hour. We've got 30 minutes more. Really, thank you to all presenters for a very rich and varied set of contributions. I'm going to invite now the panel again in the order that they spoke to see if they have any reactions based on what they've heard. And then after that, I'll open for questions and answers with the audience. People may, if they wish, put questions in the chat already. But over to you, Natacha.
Thank you, David, and thank you, all of you. It was really, really interesting to listen to your different perspectives. Yeah, I just had one simple question for you, Michael. Where did your idea of the death over dinner come from?
Yeah. Well, there's obviously personal history and reasons for why we're called into this work. I imagine that's true of anybody who's on this call. My father was diagnosed with Alzheimer's when I was in 2nd grade. He was 72 years old when I was born, so it wasn't early onset. It was full-blown Alzheimer's. And he died when, so diagnosed when I was 7, he died when I was 13. And my family did an absolutely terrible job of talking about his illness, his imminent death, talking about our grief. And it really had a lasting and profound effect on our family. It destroyed much of the connectivity in our family, both nuclear and extended. It took us to today still working on 40 years later. So that's the personal side. I've been hosting difficult conversations with global leaders and with different communities for the last 25 years. And I've learned what can happen around even geopolitics. If you give me two to 3 hours and a table, and people willing to really go there in conversation at a leadership level, but I got tired of just working with leaders and don't necessarily believe in trickle-down economics or trickle-down cultural change either. And so decided we wanted to create a grassroots conversation model. And so Death Over Dinner is heavily influenced by the Jewish Seder, which was influenced by the Athenian Greek Symposium, and was like, can we create a new ritual that can scale? So many other influences, but those are the basics.
Yeah,
Thanks.
thank you.
Natasha, did you have any other comments you wanted to make?
Just for Mio, Urade, how many people do you have at those deaf festival? And since the start, have you seen more and more people, the word of mouth working? Just for me, for good tips, because we're trying to organize events for the general audience. And when you talk about deaf, it's like, oh my God, no.
日本語で答えさせていただきます。今年は4200人以上の方に参加いただきました。
Okay, so I would like to speak in Japanese. So this year, we got 4,200 and more people participated.
で、今年3年目になります。なので、デスフェス自体は2回開催しております。
So today, this year, we are marking the third year. So we've done, that means like twice of Death Fest in the past.
はい。去年は2000人だったので、倍以上に増えているので、来年はさらに増えるといいなというふうに思っております。
So last year we got the 2,000 participants, and we got the 4,000 or more people participated this year. So hopefully, like we can get more next year.
で、一つ気をつけているのは、やはり中立的立場、多様性を重んじるということをすごく気をつけておりまして、なので、どんな死生観を持っている方でも安心して語れる場ですよっていったところを実現できるようにすごく気をつけて運営をしております。
One thing that though, that I always keep in mind while hosting or in preparation for this event is that, taking the neutral position and also diversity. We always try to focus on that. So no matter, what kind of view of life and death that you will have towards the morality, what kind of, opinion or attitude that you will have, so that, people can talk freely of peace of mind. So we like to have a, psychological, safety environment when we are to have that kind of event. That's one thing that I am always keep in mind.
Thank you.
Thank you. Over to you, Michael, if you have any observations on what you've heard.
Well, I already emailed Mio because I would love to come to Japan and experience Death Fest. So there's an email in your inbox. This is a question, I think, for Natasha and Richard and a little bit David. And it's a question and an observation. One, the question is specifically to Natasha, but also I'm sure it touches on Richard's work. Do you feel that the adoption and the normalization to some extent of doctor-assisted death, or what we call death with dignity, and what sounds like you call doctor-assisted suicide in Switzerland, I'm curious if you feel like the legality of the practice has changed the larger Swiss public's general conversation about death, and I wonder if that practice and the legality of it has gotten people, whether they agree with it or take part in, or avail themselves or family members of this option, has it increased literacy and just general end of life preparation? And I must pose that question there and then give a little bit of context. In the United States, the Deaths with Dignity folks, and it's a large number of folks that advocate for and work to legalize death with dignity in it's obviously very different in Switzerland than we have here. You need a 6-month terminal diagnosis in many states, et cetera. But I find that you're either a death with dignity person who's talking about it all the time, but if you're a palliative care physician, you don't want to be asked about it. You don't want to talk about it. You're like, that's just over there and I don't want to touch it, too hot. And I think that that's a real missed opportunity for the United States. But I'm just curious if you feel like it's had an impact, and also, Richard, your thoughts on it.
Yeah, it does.
Go
Sorry.
ahead, Natasha and Richard, and then I'll have something to say from the Netherlands
Yeah.
perspective.
So what I find really interesting is because religion is there as well. So I have to remember that. So people who will be really Catholic practicant, they will have a hard time with that. Protestant would be a bit more open, but the society is secularized pretty fast, so it's more open. And what I realized, it's actually, as palliative care, I'm happy you have this option as well, because it shows what palliative care is. So we'll be there till the end with you, the quality of life, we'll help you and your family. But people feel reassured to know that this other option exists. So what we realize is that we have people who, because in Switzerland, you have to be clear-minded when you write the paper and sign it, and they'll recheck it every year. And you can't ask for assisted suicide if you already have Alzheimer and you're not clear-minded any longer. But people, what happened, we can see that people have written, signed up for Dignitas or Exit, but actually they will never use it. They will go for palliative care. But just the fact that they know that if this kind of situation happens, if I feel too afraid, and I'm not sure that maybe palliative care doesn't do what I want it to do to help me, I have this option. And for us, for palliative care, it helps us show, well, you have this option as well. You don't have to, you can use Exit if you want, but if you don't, we'll be here with you to help you and your family. So it helps in the discussion. So I find it actually really positive that citizens have the choice. And I see it as another option, because I know we have debates in France about it, and I can see how, things can go between palliative care and these options, and depending on people, how they feel about it. But it helps to talk about it. So I think it's a positive side. I don't know if Richard or David wanted to add something.
I think you're exactly right, Natasha. I think there's a lot of evidence that the fact that it is available is in some ways the most important thing. A lot of people don't use it, but it is there potentially. Here in Britain, it's not legal at the moment. People have to go to Switzerland and Dignitas, as quite a lot of British people do. And it's been a very intense, very passionate debate. And one of the things I regret is it's sort of sold almost overall, I'm in favor of, like you, of people having a choice, but it's been sold a bit here as if there are some bad deaths. If we had assisted dying, that would be the end of it. Death would be fine. And that's a gross oversimplification. And I think that there's so much intellectual energy and passion has gone into this debate. And I just wish it could have gone into a much broader discussion about how can we achieve a healthier relationship with death and dying. One country which I think is very interesting in relation to this is Canada, where they have, medical assistance in dying, MAID as they call it. And, it's based, which seems most logical to me, on unbearable suffering, because we know that trying to say someone's going to die within 6 months, we're very poor at that. We cannot accurately predict who's going to die. And in Canada, when there was a big argument before it was introduced, and then it became very normal quite quickly. And there's an interesting account. It sounds like a similar story to yours, perhaps, Natasha. Here in Britain, palliative care people tend to be passionately against assisted dying. And in fact, there was a piece in the BMJ that 3 palliative care physicians wrote saying, we actually see a case for it. And they had to be anonymous because they would have taken such abuse otherwise. But the president of the Canadian Medical Association, who's a palliative care physician who looks after the homeless in Toronto, he was against MAID. But then an elderly friend, a retired professor, said, I want to do MAID and I really want you to do it for me because I trust you, I'm very fond of you. And he did. The palliative care physician, helped his friend, and it changed his view. And he reached the point that you seem to be at, Natasha, of thinking this is an option. It shouldn't be the first option. There are many other things we can do to help people die well, but it should be an available option. Whether that will happen here if it's introduced, I don't know.
It's fascinating. David, I want to hear what you have to say, but to your point, Richard, I find in the US that publicly palliative care physicians are against, privately, passionately for, but they don't feel like they can publicly support because of their peers. Anyway, David.
Yeah, I'm conscious of time, and I haven't seen any questions in the chat. Thank you, Dan, for the references you shared. Do please put questions in the chat, audience members, if you wish to join or indeed put your hand up. I'd say quickly, from a Plenna point of view, we take a neutral approach towards assisted dying, in sense it's the only approach that we can take. And I can say from the Netherlands perspective, I was there in a conference on death, dying and disposal 3 weeks ago. It's been legal there for 25 years. They're perhaps one of the leading countries in terms of the experience. And it's increased fivefold since it's been introduced, but they think that is probably due to people becoming aware of it. But there's clearly still a certain degree of misunderstanding among the population, thinking, oh, you can just have assisted dying, when there are very clear criteria that you need to follow before you're actually considered for dying. For example, being assessed by 2 physicians. And they said, this is a complex and a difficult discussion that we continue to have. It's not an easy, so there is an ongoing debate which I think is necessary. The other thing, it can only function in their view if you have a very solid health system underlying it to actually provide the backup and the evaluation. So yeah, I mean, I wouldn't say the jury is out, but there are certain conditions, and clearly it needs to be adapted to each country. Let me, however, continue with the round of inviting the panelists to share their reflections on what they've heard. Mio and Nozomi, do you have anything to ask or to reflect?
ありがとうございます。今日は本当に貴重な学びがたくさんあって、私たち日本では死はタブー化されていると思っていて、で、死を起点にウェルビーイングを目指すという活動をしていますが、グローバルで見てみると、その死の問題っていうのはグローバルパラドックスがあるっていう視点は新たな視点で、もしかしたら日本にも私たちが気づいていないパラドックスな問題が生じているのかもしれないなというふうに一つ感じました。
So one thing that I would say first is that, there are so many things that I learned from this session. And as I mentioned in the presentation, the death has been, considered as taboo. Like we cannot really talk about it in Japan, but like we are trying to start from the death and then lead to more like well-being type of the living style. And also I've heard today that there is the paradox about the death globally, and that was new perspective for me. And I thought that I started to think that there might be some paradox even in Japan toward the death that we have not really noticed yet.
もう一つ積極的安楽死の問題については日本でもここ数年割とホットトピックになってきているような気がします。特に日本では合法化されていないので、オランダなどで、その医療ツーリズム、安楽死ツーリズムといったところが生じてきて、そのドキュメンタリー番組がすごくヒットしたということもあります。なので、どのようにその議論を進めていけばいいか、進め方を日本では模索しているのかなと思っております。そこら辺ご意見をどなたかいただければと思います。
Well, assisted death is one of the hot topics to discuss in Japan. And in Japan, assisted death is not legalized. But it is legalized in, for example, Netherlands. So many people, some people join in the medical tourism to go to Netherlands and have assisted the death. And there was one documentary created on the theme of assisted death in Netherlands, and it was well received by many people. So I think that in Japan, we are searching for a way how to be engaged in a discussion, how to proceed with the discussion. So on this point, if there's any opinion or a comment from other panelists, then I would like to, I'm more than happy to hear them.
いかがでしょうか。
Thanks, Mio. I think on assisted dying, if we maybe put that to one side, because I want to make sure that we have time to discuss. I can certainly send you some information and some thoughts afterwards, and perhaps other panelists can as well. Let me invite Ayman to come in with any reflections based on what he's heard.
Thank you, David. Well, actually, I second Mio that I have learned a lot from listening to this conversation. And actually, it's not just learning, it's like making some adjustments in my head, because I personally have never given that depth of thought on the value of dying, the conversation around dying, and the whole what's the word? The whole philosophical aspects of dying. And this is something I very much look forward to reading about. One thing that I would like to ask, and I'm going to look into this, is the economics of dying, and whether the discussions, the policies, the legality or the illegality of assisted death, are they by any means driven by or related to the cost of palliative health care, and whether the opportunity cost of legalizing or illegalizing assisted death is very much related to the cost of palliative care or not, whether there were any economic studies on this or not. It's an open question. If one of the panelists has an answer, I would really appreciate it. If not, it's just one of the reflections that while listening, came to my mind. Over to you, David.
If I may intervene. So I don't have the numbers, but I have to find them again. Usually what we say with palliative care, if you start them really in advance, when you have the diagnosis, it will prolong your life. You'll have a better end of life, and it will actually cost you less. So it should cost less to society. That's actually the last things I've seen, but I have to find the data again. So that's usually what we promote. So just
Thank you, Natasha. This is very helpful, and I don't mean to confiscate the discussion, but looking into the cost of death, not just from the monetary value, the social cost, the economic cost, versus the cost of palliative care for a very extended period of life. It's in my head, and I'm sure countries like yours in Switzerland and many advanced countries like the UK and Japan, I'm sure you've delved into this, but it's good to have these kinds of discussions because it opens your mind into new things. Over.
And if I can add the advantage of palliative care as well is that you have, well, then it depends on the person as well, but you are facing death, you have time to think about it, and time, if you want to discuss about it with your family. So you can actually completely erase the taboo if needed be. So that's why we always say that in palliative care, we take care of the family as well. So we help them with that. Actually, here in Geneva, we have the Café Mortel. We have some workshops as well for families to explain how it happens with the body of your loved ones at the end of the life, how you can prepare yourself. So we have plenty of things. But when you do it, actually, you take time to reflect on all that. And prepare yourself and your family, if you're open to do it, of course, because then we can see all different kind of situations and people who refuse to accept that they're going to die, and that's a whole other discussion.
Great. I'd like to give the floor to Richard, who wanted to come in, and then Dan. I think you might have a question. I want to make sure that we get that in before we finish. So over to you, Richard.
Yeah, just to say something on the economics of death and dying. I mean, our commission included an economist. And as Natasha said, there are studies that show that if you compare people dying under the care of palliative care physicians with people dying in hospital or wherever else they die, you get a much more cost-effective death from palliative care. So palliative care itself need not be expensive, but there have been a lot of studies on just how much money is spent on people at the end of life. And at a conservative estimate, about 10%, and it's probably much more, of the expenditure of a health system like the NHS is on the roughly 1% of people who die in that year. And as we have more and more expensive treatments for the end of life, particularly in relation to cancer, but I've just been listening to one about Huntington's chorea, which is going to cost roughly £1 million a patient. I do worry, does that make any sense? Because healthcare in many countries is beginning to crowd out, as economists say, things like education and housing and the environment, things that are actually more important for health. So does it make sense to be spending so much money on keeping people alive at the end of life, especially when often you're increasing their suffering? Two other points, I suppose it's related in a way. Responding to Michael's story about his family, I think there's a lot of evidence that bad deaths have terrible repercussions, in all sorts of ways. So a good death, whatever exactly that is, and it's not so easy to define, has all sorts of benefits in what happens thereafter. And just a word on festivals. There was a death festival here in London that went on over 3 days and was held in the festival hall. There was music, there was dancing, there were debates, there were speeches, there was an exhibition of coffins from Ghana. And the people who held it, it was a great risk. They didn't really know whether anybody would turn up. It was based on the idea that we don't really have a place to talk about death and dying. It used to be the church. It's not that in Britain anymore. So they put this festival on and thousands of people turned up. It was enormously crowded and you had to queue for sort of half an hour to get into a session on suicide. There were 500 people debating assisted dying. I remember a one-man play describing taking his ex-wife to Dignitas, and it's a play that has stuck in my mind ever since. So it was a huge success. It hasn't, unfortunately, been repeated. I mean, if anybody's interested to read more about it, I wrote a series of blogs that you can find and are referenced in the Death Commission that you could find. But I would urge you to try and put on a death festival. It can be a wonderful event.
Yeah, and very hard to find funding for, Richard.
Yeah.
That's probably why there was only one.
Yeah, exactly.
We're coming to the close of our time. Noting comments in the chat from Dan and Rory. Dan, I don't know if you wish to come in with a question or a comment.
No questions. Thank you, everyone. I put my 5 references and comment in the chat box, in that I would stress equality in sharing stories without hierarchy. That's the key to me.
Yeah, and so there was a suggestion, Richard, that you drop the link to your blog in the chat. One reflection, something that I read, I think it was Newland in a book, he said that actually if you don't try to live longer, paradoxically, you will live longer. So just to chuck that in. I think this is probably a good moment to wrap up, and just I will ask nobody else seems to be putting any questions forward, so I will ask the panelists just to have a last words in order. Natacha.
I just wanted to thank you all, and I hope it progresses the discussions about death and palliative care as well, and how to break the taboo concerning death, because when we'll be able to talk about it, all the rest will follow. Things will, I'm convinced about it, it will be easier as well. Take decisions to discuss and not to be afraid any longer.
Yeah, and I'll just close in saying things are changing. When I started my work 15 years ago, and I would go to a cocktail party and people would hear what I was working on, they'd lean back, and then they'd lean in. They'd always lean in. They always want to talk. They have to like first lean back. Now, I don't like saying that I work at end of life when I'm at a cocktail party, because people will just come to me. The death guy is here, and I have to talk about, and I'm like, I just want to talk about the Yankees. Not really, but so things are changing.
Mio, and Nozomi?
ありがとうございます。今日は本当にいろいろなお話を聞けて、とても勉強になりました。貴重な機会をいただいたので、これからぜひつながっていけたらなと思っております。来年のデスフェス、よかったら皆さんにもお越しいただきたいです。これからもよろしくお願いいたします。
So yes, again, thank you very much for this opportunity. I learned so many things this time, and the next year, like we are going to have a Death Fest again. So I would like to invite all of you to Death Fest Japan. So thank you very much. I would like to keep connecting with all of you. Thank you.
And Ayman.
Well, again, David, thank you very much. And a very, very deep pleasure for virtually meeting all the panelists. I learned a lot, and I have a long reading to go through. So please share your blogs. I'm going to definitely read your book, Michael. And yeah, and thank you. This has been illuminating. So thanks, David, and thanks, everyone.
And Richard.
Yeah, thank you as well, and well done for getting Plenna launched. I mean, I'd agree with what Michael says. Everybody's got a story about death, and unfortunately, it's often a bad experience. I'm not sure I share his optimism that things are getting better. An oncologist friend of mine says he finds it harder and harder to talk to people about death and the end of life. It is just so much easier to just go on with another round of chemotherapy. And a palliative care friend tells me that now in hospices, people are being given intravenous antibiotics, which never would have happened a few years ago. So even palliative care is in some way being sucked into fighting death rather than embracing it.
Thanks. And so just a few closing remarks from me. I mean, I think above all, this is a universal issue. We're all touched by it. And the thing that struck me is, in terms of getting involved with it 2 years ago, coming fresh at that point, is that a tiny bit of preparation can help you in terms of your peace of mind and planning, and it can certainly help those who are close to you. And I'm glad that Ros has opened her camera, because it was a lunch that we had 2 years ago that actually set me on the path. So I would encourage you to have a look. If you haven't done so, look at the Plenna website and encourage other people to do that. I have a sense that the Japanese version might be the second language to come online, and I look forward to discussing with Mio and Nozomi to make that a reality. And thank you, all of you, for your contributions. Thank you, Rory, for guiding us through in the tech side of things. And looking forward to continue the conversation, and wishing you a great end of day, wherever you may be.
Thank you.